Good afternoon. I'm Monica Hendrickson, the Public Health Administrator for Peoria City County Health Department, and welcome to our Tri-County update. For the Tri-County, we now sit at 79,306 cases to date. That is an increase of 5,910 in the past week alone. Again, that's 5,910 new cases in 1 week. That includes an additional 2,663 cases in Peoria, bringing Peoria just under 40,000. Tazewell County added 2,501 cases last week, and Woodford County added 746. We now are reporting to date 980 Tri-County residents that have passed away with COVID-19. That is an additional 21 over the past week alone. With Peoria now adding 17 additional deaths in the past week, bringing the total to 486. Tazewell at 380 with an additional 4 deaths, and Woodford remained at 114. There are currently over 6,000 Tri-County residents at home and isolating, and 75 Woodford and Peoria County residents hospitalized. Again, due to the numbers coming in, Tazewell County is having difficulty maintaining their hospitalization rate values. Our Tri-County now sits at adding 844 new cases each day, which compared to 1 week ago was 682. And Peoria County also saw an increase with now averaging 380 new cases each day compared to the 362 last week. I said this last week, and sadly it still holds true today. Since March 16th of 2020, this is the highest daily increases that we are seeing in our Tri-County. Currently, OSF, St. Francis Medical Center, and Unity Point Health Central Illinois are reporting 35 ICU beds in use and 200 non-ICU beds in use. They're also sadly reporting 9 deaths in the past 24 hours alone. Our ICU bed capacity remains averaging 45 beds a day. However, our non-ICU continues to grow, where we now are averaging 220 beds in use each day. As part of Region 2, our ICU capacity still is under 10% availability. And again, as Dr. Nutt mentioned in our previous press conference, that is actual beds, not staffed beds, which is even further lessened. Peoria, Tazewell, and Woodford are all seeing positivity rates above 20%, with Peoria at the highest at 27.3% is our positivity rate. Last week, we had our 2 large hospital systems discuss what the impact of this is in terms of providing care, the morale and trauma that our healthcare providers are facing each day as the surge of cases continues to grow. But we should also note that those 2 healthcare providers are also our largest employers. And so this is not only impacting our largest employers, but even our smaller employers. And to talk more about what this is and impacting our business community, we have Chris Setti, a CEO of Greater Peoria Economic Development.
Good afternoon. I keep saying, I wish I didn't keep getting invited to these things because it just means that this has been prolonged. So Chris Setti, the CEO of the Greater Peoria Economic Development Council. Monica had asked me to speak a little bit about the impact that this has had on our businesses and what are the things we can do. What we've really seen is really an exacerbation of an already problematic labor shortage. For the last year or so, we've seen employers struggling to find employees. And now what's happening is that the employees they have are getting sick and not being able to be at work, which is just compounding an already difficult problem. You know, it's an unfortunate situation, but I do think there are things that the buying public, the consuming public can do, which is to continue to advocate. I think employers can continue to advocate for vaccines within their employees. I think that patrons and customers can wear masks, do things to help slow the spread. You know, as we've learned from Omicron, it's very contagious, and that people are often, because it's maybe less severe in its in its impacts, there may be more people who are asymptomatic, who are helping to spread, that don't even know. So very simple things like wearing a mask can just help a little bit. And you're helping the business owner when you do that, right? Because you're helping maybe keep their employees safe, so that they aren't end up having to sit on the sidelines because they've tested positive. Luckily, we haven't seen a downturn in the economy from this. We still see some strong signs in the economy, but we're always just a little bit away from that, right? If people, whether there are imposed shutdowns or restrictions or not, the more this becomes prevalent, the less people may want to go out and spend money and shop, and that does have an impact. So we, as a community, need to pull together to continue to figure out, what are the things that we can do to get this under control, so that we can get back to a normal business patterns for our government, for our local businesses to be able to thrive. So if there's any questions, I'd be happy to answer them or turn it back over to Monica.
So actually today, the Supreme Court, they ruled that large businesses don't have to mandate their employees get vaccines. Do you think that we're going to see some effect of that in our own Peoria area?
I imagine so. I just saw that as I was leaving the office. I just saw the headline, so I didn't read any more about that. That was a federal mandate for employers that were over 100, had over 100 employees. We have a considerable amount of companies that are over 100, but most of the economy is supported by small business and small business of 50 or less employees. So I don't know if it has sort of the impact one might expect. Some of our largest employers, our healthcare providers, Unity Point and OSF, are two of our largest employers. We're already mandating those. So this is a Supreme Court ruling around a federal mandate that employers do this, but it doesn't actually prevent employers themselves from doing those things. So I don't know if the impact here will be as great as you might imagine.
Can you tell me how the current surge of Omicron variant is impacting restaurants' business model locally?
Yeah, thank you for asking that question. I think that our business, throughout COVID, from March of 2020 through now even, our businesses have had to adapt. And the restaurant business, maybe more so than anybody else, has had to adapt. Early on, it was making sure that they had easy ordering via website or social media, having a social media presence at all. So a lot of the smaller restaurants didn't ever think about that, right? When we reopened in June and July of 2020, but only for outdoor seating. Originally, if you remember that, we saw our businesses increasing their outdoor seating capacity, building temporary or permanent expansions of their outdoor capacity. That continues, and I think that's one of those things that will continue. I know I was speaking with a WMD reporter this afternoon about Smoking Pit in Northwoods Mall, and they are expanding, but in expanding, they're making sure that their tables are maybe a little further away. I think that you're seeing restaurants make sure that they have delivery options and easy curbside delivery or drive-through, even if they're able to put like drive-through windows or drive-up windows. I think we'll continue to see that. I think it's probably good public health policies just to begin with. And those businesses that continue to be flexible and invest in the future, I think are going to be the ones that are ultimately the most successful in weathering this storm. I'll turn it over to Monica for the hard questions.
Thank you, Chris. Also, we did release as a TriCounty a bulletin, I believe on the 11th, regarding updates to the contact tracing and disease investigation program. And thank you to Chris and his team at Greater Peoria Economic Development for pushing this out to our business community. Today marks the day where the state has moved into what's known as the SURGE Contact Tracing Program Protocol, in which cases that are testing positive are moving to a centralized system, which now allows locals to focus on those high-risk, highly vulnerable cases that create outbreak and really spread quickly. So think about congregate living settings, whether they're homeless shelters, correctional facilities, or long-term care. And so with that, your local health department will be focused on those high-risk populations where the virus will have a large impact in the severity of illness amongst that population, as well as the severity in risk regarding mortality or death. So with that in mind, your local health departments will be much more focused in that intervention. We do ask, because of the number of cases we are seeing, again, averaging over 800 new cases a day in the TriCounty alone, that we're not able to do release to work or release to school letters. So if you are an employer that is requiring a release to work notification or a letter, please note that your local health departments in the Tri-County currently do not have that capacity. We recommend that you follow with the CDC guidance as well as the Illinois Department of Public Health guidance regarding the 5 days for isolation, mask wearing aggressively for the next remaining 5 days, as well as for quarantine, following those protocols and recommending getting tested. We understand this is challenging. For the past 2 years, we've been really focusing on making sure people were equipped to, move into these challenges, making sure they had the right resources. As we're moving to this new phase of our pandemic, a lot of the things that we had in place were allowed to start, I would say, kind of lifting or changing the course of them. And it's not because we are thinking this virus is any less significant, but is our ability to respond has changed drastically. Again, 2 years ago, we were talking about access to PPE, we were talking about ventilators, and now we're talking about the ability that there is no appointment requirements to get a vaccine. So again, a lot has changed, and so we are responding accordingly. Contact tracing is still very, very important. It is a foundational aspect of any type of public health response. We're not stepping away from it. We're just making sure it's focused, again, in our highest risk populations. With so much community transmission, contact tracing is only going to be as effective as if we're getting that information or able to stop really high spread activity. And so again, we're still going to do contact tracing at a local level, but it's going to be very much focused at those places. The schools received new guidance this week, about what it means to come back to school in terms of testing, isolation, and quarantine. I would like to thank Beth Kreider, Superintendent of Peoria County ROE, for hosting numerous calls with superintendents. It had ability for them to ask me direct questions and vice versa, so that we have them prepared to really adopt and understand what this new protocols are going to be and what those are going to mean for them. With that, I'll open it up to Q&A. So the school districts were all told they could adopt the 5-day isolation and the 5-day quarantine policies on Friday of last week. The Illinois School Board of Education and the Illinois Department of Public Health issued on the 11th cleaner guidance on the areas where there might be some just questions about kind of what does it mean in these specific locations. So all of our schools in Peoria County, both public and private, have adopted that. I will add, this applies to K through 12. Early childhood education and daycare guidance has not changed. It is still not adopting the 5-day. And so again, for that population, we understand we have a lot of parents reaching out, a lot of daycares reaching out. We have heard you. DCFS, which licensed them, has also heard them. The CDC, our understanding, is making updates, but that's a different population when you're talking about early childhood education as well as daycares. They are not necessarily all eligible to be vaccinated. If they're under 2, masking becomes very difficult, as well as social distancing. My own children went through daycare, and I would have to imagine that they're, the amount of hugs and kisses that are given at every goodbye makes it difficult to do some of those basic protocols for COVID. So again, We understand there's a little bit of confusion regarding early childhood education and daycares, but as of right now, the guidance is still the same prior to the 5-day, 5-day.
Contact tracing change, is that kind of an acknowledgement that A, this thing is so widespread that it's so difficult to keep up, and B, also I know a lot of people hostile towards contact tracers when they call asking questions, so is it more like the expense, the time and the resources invested into this were no longer enough benefit to do it on a wider scale anymore?
So the question regarding, what is this transition in terms of contact tracing? I think there's a multitude of reasons. Yes, I think part of it has to do with the impact we were getting in terms of were we getting reliable information from some individuals. And I will say when we started contact tracing, right when the pandemic went out, we would get very detailed information from the public. We would be averaging anywhere from 4 to 5 contacts from people. Now if we get one, that's impressive. And so I think part of it is, one, the level of interest in people sharing that information with us. Two, I think it is becoming so widespread, the virus, that we're not able to use contact tracing to actually get ahead of it. I think that's part of the acknowledgement of it. But I think the other last focus of it is, again, contact tracing is still a reliable aspect in those high-risk situations where one case, because of how they're living together, rather than creating maybe just 2 or 3, is now creating 10, 12, especially with Omicron being so highly transmissible. So again, contact tracing is still a very viable public health intervention. We use it for all other types of vaccine preventable diseases, or sexually transmitted infections, HIV. We've worked with it for years. But I think we acknowledge that our landscape also looks different. One, just the level of virus, but also the fact that we have vaccines. We can't ignore the fact that we have actually a medical or pharmaceutical intervention that works. And so again, it's a really different landscape that we're in, where everyone has access, a majority of the population has access to a vaccine.
So when talking about the severity of this current surge, then is it better to assess how severe that is based off hospitalizations and deaths versus just raw case counts?
In terms of the severity of the illness, and I'm glad, Tim, that you brought this up in terms of what is a good metric. I will say, we report cases each day, the TriCounty does, and we've talked about this because we're now seeing so many at-home tests where individuals, based on, they may not have children in school, they may not be working, in an office setting, or don't have to report back and are working from home, that they are taking at-home tests. Those tests do not get captured in the numbers. So the number you are seeing is by default right now an underestimation of the amount of virus we have. So when I say we're averaging 800, that's a low number. That's the bare minimum. We're definitely much higher than that in our community. So I think, part of what we're seeing for numbers and what's the stronger metrics and why we are concerned is exactly right. It's the hospitalization rates. That's not changing. In fact, we're seeing the highest numbers still, as well as, our labor shortages. That's a good indicator of what's going on as well. And then lastly, the deaths that we're seeing, and the fact that people are still dying, even though some people would like to write off Omicron as mild, not to everyone. It's still severe to those that are immunocompromised, have underlying health conditions, and are unvaccinated.
So even though the Omicron variant is so widely spread right now, and cases are just surging like crazy, are you guys still able to pinpoint where the majority of the cases are coming from, or what activities are linked to, or are you able to still do that?
So with the high levels of cases we're seeing now, we're not able to have that, this is an outbreak starting at this centralized point. It's so widespread, but we're still seeing the same trends in terms of how it's spreading when we are interviewing individuals. And what we are seeing is, one, gatherings. It's always gatherings, whether it was holiday gatherings or visiting family. That is where we're seeing a lot of this spread quickly go through. We're seeing also that it is, again, within unvaccinated individuals. That is where the brunt of this is at. So again, our unvaccinated population is helping this virus continue to spread throughout. There's so many hosts. And even though individuals might have been vaccinated or boosted, they'll still get a mild reaction, and their ability to transmit is also decreased. So really, the spread is really driven by those unvaccinated individuals.
One thing I've noticed, those infographics that OSF releases showing the vaccination status, people who are hospitalized. I notice more and more people showing up on that are vaccinated, they haven't gotten the booster, and it makes me wonder if you're seeing that population grow in people who got the initial vaccinations, but for whatever reason have not gotten the booster shot.
So I think in the hospitalization data, and I appreciate OSF St. Francis Medical Center for releasing information regarding vaccinated versus unvaccinated. We're still using the definition of vaccinated being having finished their entire series, whether it was Johnson & Johnson or one of the mRNA vaccines. But we have the data that shows boosters are really important to be getting. Your immunity wanes even after that. So they are looking at, trying to see if they can capture booster data to see what that difference is. But just, talking with our healthcare providers, we have an ongoing call with them every few weeks. We're seeing that the severity of those cases are amongst those that are, unvaccinated, still make up the largest percentage. And those that are vaccinated are definitely are eligible for boosters but have not yet received it. So for those that have been vaccinated, thank you for getting your primary series. Thank you for doing that first step. But again, we're asking you to step up to the plate and also get your booster. We have seen people that are fully vaccinated pass away, but they are also individuals that are fully vaccinated that would have also been eligible for a booster. And lots of times there's complications that have underlying health conditions that made them, a prime candidate to get the vaccine because of those complications.
Fully vaccinated and boosted, have we seen any of those folks die?
Not to my knowledge.
Now, when you say we're at 27% positivity rate, let's compare that. Have we ever seen 27% positivity rate in Peoria?
The only ever time that we've seen a 27 positivity rate was when we had very few tests and we were using them primarily where we knew it was COVID. So I would say early 2020 when we only had a handful of tests and we were using it for those individuals that had risk factors that we knew brought them forward having been COVID positive. But in a time period where we've had such readily available access to testing, no, we've never been at this high level.
What was the highest positivity rate we saw prior to Omicron?
Prior to Omicron, I would say we were at 20%.
20%?
Around 20% was our highest, I would say.
And it's 27% this week. What was it last week?
I don't have that number available. No. But all of our positivity rate data is available on either the Peoria City County Health Department website or the IDPH website, historical data.
So one other thing people are probably wondering, after last week's press conference hearing from hospital leaders, and now this week hearing that the situation is still much the same, what is the light at the end of the tunnel? Are we even beginning to see a hint that this might be starting to ease off at all?
I think the light at the end of the tunnel is, it's a really hard thing to visualize right now, which is completely a 180 from where I was this time last year. I think you're having to see and recognize that we are going to be eventually living with COVID-19. But what we can't live with it is at the point where our hospitals are just flooded to capacity. These are unnecessary utilization of our hospitals. So again, we're not necessarily accessing our healthcare services at full capacity. We're not being able to take care of the other plethora of health issues that might arise, whether they're emergent or things that people need for quality of life measures too. So I think right now the light at the end of the tunnel is when we start seeing cases plateau and start going down. Because while Omicron might be less severe, when you're seeing the numbers that we're seeing, so the N as we call it, right? If it still keeps growing, then that percentage, whether it's only 10% or 5% of a population with Omicron is getting hospitalized, that's still going to keep growing as your cases keep growing. So, the bottom line is, if you haven't, get vaccinated. If you're eligible, get your booster. And then lastly, think about how you access the healthcare system. And I'm not just talking about emergency departments or the hospitals. We're seeing prompt cares. We're seeing routine appointments getting canceled because we have to divert staff, again, labor shortage, to areas of high need response. And so again, think about those processes and what does that mean for, screenings and basic care that are very valuable for people. It may be nothing related to COVID, but you're creating then another gap in another, issue or crisis. So really the light at the end of the tunnel is when we can get cases to a point that we start seeing hospitalizations come down.
Going off the labor shortage, the other day the governor said that they were going to be bringing in more healthcare workers. Do we know if the area is going to be seeing any of that, or how many?
So both OSF St. Francis and Unity Point Health Central Illinois have asked for federal resources through that program. I'm not sure when or if they're getting their nurses or other healthcare providers in, but they were part of that conversation and they have requested those resources.
Yeah, and going off of recent events and more knowledge, I feel like it's still good to reiterate this, but if somebody had gotten COVID before and recovered from it, should they still be worried? Should they go out and get a booster or vaccine?
Even if you've already had COVID, we recommend that you do go and get vaccinated. Again, the vaccines have shown that they are highly effective, as well as, regardless of what type of COVID that you've had, Delta, Alpha, Beta, we can go through the Greek alphabet as much as we can, but the vaccines are much more universal and much more protective than just getting the virus on your own. So definitely, if you are out of your isolation period, if you're out of your quarantine period, and you were not receiving any treatments that might create a reaction, come down to the health department. It's walk-in 7 days a week.
How was the response been to the walk-in clinic over the weekend?
So we had our first walk-in at the health department on Sheridan Saturday and Sunday. I think in total we saw just shy of 300 individuals.
That's great.
We are very excited about that, and we're going to continue doing those walk-in clinics to the end of April. We will be closed, though, on Martin Luther King Jr. Day in observance of the holiday, and so on that day we will not be hosting a clinic on site, but then we're going to be open the Sunday before and the Tuesday after, so please stop in.
The walk-in clinics, were they first time, were they boosters, what was the majority?
We saw a majority of boosters, I think, overall, but we still saw people coming in and getting their primary series. So again, it's never too late to get your vaccine. And we have teams going out, and I think one of the greatest stories, we had a school district out in Elmwood that had access to team, and they were polite to say, I think we're only going to get 12 people signed up. That's 12 more people vaccinated, so it matters.
The return to work letters, it sounds like IDPH is kind of pushing for employers to quit asking for those. How big a problem is it going to be? How big was the demand for return to work letters?
I think the demand was very high on your local health departments. I would say of the, I think on day we had over 300 phone calls. I would say 90% of them were requests for return to work, return to school letters. So again, a lot of burden on our team to take them away from disease investigation by issuing these letters. And so hopefully we're asking, to just consider that, look at your calendars, be cognizant of that. You should not have sick workers in your buildings. I think Chris can speak to this, an individual that's ill coming in, and you might get them for 2 hours worth of work, but they might be taking out 3 other of your staff at the same time. So it's not really a return on investment for them to work ill. So again, putting those good practices into play. And then hopefully I think the state, as we go through this centralized system, is looking to get a more automated approach. So hopefully if letters are needed later on for travel reasons or what have you, there'll be a way to access it.
So when you say an automated system, that would be you tested positive on such and such a date, and 5 days after that you get a letter.
I think it would be more of getting them signed up to automatically start their health assessments.
Okay.
Yeah. Because again, remember, not everyone is released at 5 days or at day 6. It would be really dependent on whether or not your symptoms have improved. Well, thank you, everyone. As usual, if you have any follow-up questions, please direct them to Diana Scott, and we can kind of coordinate that. We will see you next week. Thank you.